The postpartum period for new moms can present a myriad of symptoms, some that health experts say are normal and go away on their own, and others that experts say may present more challenges that need a deeper level of care. I sat down with a local counselor for a better understanding. All right, Angela, now many people think they know exactly what it is, but what is postpartum depression?
We think we know what it is, but we don't have all the information. So one of the really, I think, interesting things about postpartum is it really is kind of three different pieces. So the first that women tend to experience is called postpartum blues. It's often shortened to just baby blues, and so that happens shortly after you give birth. And that is really more of a transient depression, more of dysphoria. And so what I mean by that is like it's more short term. And so it's not the full-blown depression. It's just more of that dysphoria, unease. It's that dissatisfaction with life and not full-blown depression. That one tends to resolve on its own within a couple of days. So starts shortly after birth, then resolves all on its own. And that one tends to impact about 70 to 80% of women.
Okay, and what form of postpartum is observed or experienced most often?
So when you think about actual postpartum depression, that is its own diagnosis, not connected to the baby blues. So postpartum depression, it impacts about 10 to 20% of women. That one is really tricky because it can start shortly after you give birth, but you may not see symptoms all the way up to a year after giving birth. And I think that's why it can sometimes be confused with other things, because I don't think you would, just as a normal person, I wouldn't typically expect that to happen a year later, but it can. And so when you think about timelines on those, and people often go, well, when will that resolve itself? When will those things, when will I feel better? Well, it's when did your symptoms present? If they presented shortly after birth, then you can see about 3 to 6 months before it's resolved. But if it didn't start until a year after, now I've got to wait 3 to 6 months after that year mark. The other one that I think is a lot less common and not well known is postpartum psychosis. And that's pretty rare, happens in 1 to 2 women out of every 1,000 women. And that one is where you have the hallucinations, the delusions, and that one is, if not treated or undetected, can be a lot more detrimental to the mom just because of suicide and then harm to the baby.
What generally tends to cause postpartum, or what are the symptoms of it?
And it really is lots of extraneous variables. Because of that, it's hard to track down, like, what is the actual cause of it? Well, brain chemicals are different. You've also just had a baby, so you had a major bodily change, life change. It's also impacting like your relationships and how you feel about yourself, so it's impacting your thoughts. And so it really is not just one thing that causes it. It can be a lot of things, and it really is based off of that person. Can also be genetics. You are more likely to have a struggle with or experience postpartum depression if you've experienced depression and anxiety before you've given birth, or if your family has a history of postpartum or depression or anxiety.
We're visiting with a local counselor this morning for a better understanding about the postpartum period for new moms and the symptoms it can present. Here's more. Last time we were here, you kind of alluded to how you dealt with postpartum. Talk about your experience with that, and what was your treatment?
I think there was a time when it was hard to talk about because there's still that stigma of like, oh, I don't want people to know that I had those thoughts. And now I enjoy talking about it because I want people to know, while that experience, those thoughts are not normal, just in a normal day during postpartum depression, those intrusive thoughts are the things you're going to have. And if we can openly talk about those, I think that women are less likely to go undetected. And so for me, what I really noticed was, well, first of all, I knew that I had anxiety before. I knew I'd experienced depression before, and so that already put me at a likelihood of experiencing it. And so some of just that awareness is what's needed.
So how did you prepare beforehand?
And because of that, created some really good steps to take. I'd already had conversations with my husband about like, hey, these are what those thoughts could look like. This is what it may look like for me. And so he was already very aware of hey, she could struggle. And so that didn't catch him off guard. It didn't catch me off guard. And so then when I did start to have those intrusive thoughts, my husband was great. I could say, hey, could you just come home? I'd rather you be home with me so that we're all safe. And he was always happy to do it. I also have a great village with my mother-in-law and just friends who are always willing to talk about those things and share their experiences. And that was really helpful too, just having other women say like, man, I had that and I don't want another mom to go through it. And so let me tell you what my experience was. And then if you don't have a village, because I'm aware that all of our lives look different. Maybe you are pregnant really early and you've had a family that said, hey, we're not jumping on board with you. We're not supportive of this. And if you are in that boat, the best thing you can do is talk to your primary care. You're already getting care for you and the baby. And so have conversations with those people that you do have connections with and just be open about what you're experiencing.
What's that feeling like when you're going through all of these different thoughts and emotions?
It was really that cognitive dissonance, so that when you have two conflicting thoughts or beliefs, and so I knew what I should feel as a mom. I knew I should be very excited to breastfeed and to hold my baby, but I also knew that my thoughts had been hijacked and that my thoughts were going, we don't want to do this. I don't like this. And just based off of your life experiences, I think it can look very different. And so when I think about my experience with my daughter in postpartum depression, I grieved the loss of the life I had a lot. I just hadn't had my whole day dictated by a sweet little babe. And now I was attached to her at all times, 3 hours a day. I had lack of sleep. I was fatigued. Throughout my pregnancies, I worked out 6 days a week. And so so I just had to stop. So the one thing that I used as a coping skill was taken away from me. And so that was really hard.
And for young moms out there who may see this interview, what are some things they can do to combat postpartum?
One of the things I want to note is when we talk about young moms, one of the populations that is most at risk is women under 25. The percentage jumps from like 30 to 40% for them struggling with postpartum depression. And so, I think that has to do with a lot of things. If you think about your life at 25 and under, financially, things are going to look different than when you're 30 or 35. Your relationship with your partner may look different, whether you're married or not. All of those things can look very different. But one of the best things that moms can do is just have conversations with our family. Hey, mom, did you experience this? Did my aunts experience this? What does that look like from family history perspective? But then also talking to their peers, their friends. Hey, what did that look like for you?
And for more health tips and information, you know where to go, myhighplains.com.